Okay, so the last couple of weeks we've been talking about pregnancy, post pregnancy, and the need for sleep. But we're going to backtrack a bit. Do you remember when we talked about the father of epidemiology, John Snow? John Snow investigated the cause of the spread of cholera in certain communities in London. He conducted interviews with family members of individuals who had died of cholera to find common sources of infection. In the end, John Snow learned cholera spread through certain water pumps. The pump handle was removed, the community recovered, and, well, the rest is history. Without John Snow and his investigation, we wouldn't be nearly as far in our medical innovation as we are. Now we're going to focus on his studies once again. What is epidemiology? According to the National Institute of Health, epidemiology is the branch of medical science that investigates all the factors that determine the presence or absence of diseases and disorders. Epidemiology research helps us understand how many people have a disease or disorder if those numbers change, and how the disorder affects our society and economy. Like many other professions that require precise work and take months to conclude, we're looking at you police dramas, fictional works depicting epidemiology have skimmed over the scientific process. Movies like Contagion, The Hot Zone, and Outbreak do little justice to the epidemiologists in the background finding the rate of disease transmission. Epidemiologists apply data to 7 different areas of health information. 4 of the 7 different areas study disease etiology, or the study of the causes of diseases. The origins of a disease, really. Epidemiologists will estimate individual risks and chances of developing a disease. They'll identify syndromes, which are the set of symptoms associated with the disease being studied, complete the medical picture by defining all modes of presentation of a disease, its full spectrum, and outcomes in a defined population, and then they'll search for causes. For instance, epidemiology played a central role in eradicating smallpox. Through disease investigations, tracking the use of vaccines, and communication, smallpox was the first disease that people successfully wiped out. Since then, the human race has used epidemiology to do the same thing for other diseases, or are in the process of doing so. The other uses for epidemiology are rarely used as interesting plot lines in movies, but are just as important as studying disease transmission. These uses can help study populations' health. Epidemiologists study the history of the health of populations, which can provide insights in preventing poor health in populations. For instance, the Industrial Revolution had far-reaching effects on the health of many individuals, primarily the rural populations. See, one important impact of the Industrial Revolution, other than the use of coal, iron, and steam, was rapid urbanization as new and expanding industries caused villages and towns to swell, sometimes into vast cities. The port of Liverpool, for example, rose from the population of a couple of thousand to many tens of thousands in the space of a century. As a result, these towns became hotbeds of disease and depredation, promoting a debate in Britain about public health. In fact, despite technological developments, the death rate rose and infant mortality was very high. Now, the Centers for Disease Control and Prevention collects surveys each year to understand and diagnose the health of the community. According to the CDC, about 1 in 3 adults in the United States reported not getting enough rest or sleep every day in 2022. Epidemiology examines the ability to obtain healthcare services, such as prevention, diagnoses, treatment, and management of diseases, and other health-impacting conditions. It is also used to evaluate the function of health services by examining the working of health services. Here at Two Rivers Public Health Department, we're lucky to be able to apply all 7 uses of epidemiology. Right now, we're focusing on evaluating health statuses and health services. We like to call this process a community health assessment. We use health statuses and services information to understand the needs and priorities of our communities. If you're interested in this too, please join us. As always, we hope for a healthier community for all. Until next time.